a interproximal, because we want to make sure that there is a contact there. Because if let's say that we did do a filling and it was an MO, if that surface of that interproximal area is not closed enough, or if there's too much space, you're going to get food caught in there, and then that can cause some major issues with the gums or bacteria. So you want to make sure that you do have a contact when you're doing that. So you have to have floss again to check the contact.
That's what they did with my permanent retainer because of the glue. And then they used some kind of like
Floss threader.
metal because there was too much glue. So they used like some kind of metal strip, yeah.
Those can really tear your gums up too. Those metal strips can, if they're not careful. All right, so any questions on that?
So, and that's the last part is just the amalgam, so now it's on the composite.
Yes, we're finished with the amalgam. And you guys won't have to write as much for composite. So.
Yay!
So, we're going to do everything exactly the same up to your line that you drew, okay? So, you might want to label that like first part and then second part or something like that. And actually, in all fairness, that first part is going to be every single setup you ever do. It's going to be all that stuff. Everything that you see there is exactly what you'll set up for all procedures, pretty much. Except for maybe an extraction. You may not need the slow speed handpiece. But for every single thing else, you always need that stuff shown at the first part.
I guess, hold on, can you look at this and see, make sure I can write this down and everything. Because let's evaluate the two, the medical history, and then make sure.
Yep. Now this, and then this is all amalgam. Okay, and then we're good. Okay, so this is where it gets different because for a composite, we typically use 2 instruments. If you've got the right 2 instruments, these are all you need, okay? So we've cleaned the tooth, right? We've gone through that whole first part. We've prepped the tooth. We've got isolation. This is where it gets different with isolation. If it's an anterior interproximal procedure or composite, so anterior interproximal procedure, we're going to use the clear mylar strips, and wedge. Oh shoot, sorry. At you. Okay, so regardless if we're doing anterior or posterior, you always need a shade guide. And the shade guide is to choose the correct composite shade. A shade guide to choose the correct composite shade, and that's for your enamel, so that you get the correct shade for your enamel. Okay, so after you do that, gonna have etchant. And do you guys remember what the etchant does? Roughens the surface so that we can have a better bond.
And that's like sanding a surface before you like paint it.
Mm-hmm. It's essentially the same thing, yeah. All right, so once we have etched the surface, we're gonna let that sit for 5 to 10 seconds on the surface. And we're gonna rinse with water only. Do not do a rinse with air and water, because what will happen if you do that is that it's so powerful that the etchant will fly up and it can land on the face or in the patient's, God forbid it land in their eye if they're not wearing eyewear like they should. So what you want to do is the same thing when we talked about the HVE. You want to put it parallel or directly on top of the occlusal surface when you're spraying that water so that it can catch all of the excess material. And the first thing you should do before you even spray the water is try and get all of the excess etchant off with just the HVE first, so that all of the big parts of it have already been sucked up. Okay, so once we've done that, we've etched the surface, we've rinsed it, and then we're gonna dry it really well. After we dry it, we're going to need, grab something. Alright, so we etched the surface, we rinsed it. Once we rinse it, we dry it really well. And then you're going to give your dentist primer. So what you do is you put primer into a prime and bond well. This is a prime and bond well. This is just one type. Okay. Sometimes you'll see them and they're black with an orange cover because these are light sensitive. So if these are used with light being directly exposed to them, it dries out the material or it sets it prematurely. So anytime you're using composite, it has to have the light away from it. Or you have to cover it. Like with this, I usually set this on top. Or I'll set it upside down so I know which one is in which. Like primers here and bonds here. And then when I go to give it to the dentist, I have my finger covering it and I just move it when he wants to dip it again. Okay, so put your prime and bond in the prime and bond well, and then you are going to use these are called micro brushes or micro brush applicators. And they look like that. So I'll pass that around for everybody to see with the well and the prime and bond. Okay, and what you would do is the dentist, you would dip it first and pass it to the dentist. He would use it, and then if he needed more, you would actually dip it for him. Okay?
So he don't do no work at all, so he just hold it?
Yes, micro brush.
He just hold it like this.
And I would just...
Okay, and then it'll work with it.
Okay, after you've used the primer, You're going to dry the tooth, about 5 seconds. And typically the dentist is going to dry it, but if you do have to dry it, make sure that you express it first. And what I mean by that is take the air water syringe and put it to the side and push the air out first, because sometimes moisture can be in there and you cannot get this wet once we've started, because it'll cause contamination or it can cause the whole thing to fall out. Okay, so we've etched, rinsed, dried, primer, dry. Then we go to bonding. The bonding is in the other part of the well with another micro brush. Typically, what I would do is I would have a purple brush for prime and a blue brush for bond, because you cannot mix the two brushes up. You can't use just one brush for prime and bond. You have to have two separate brushes. Okay? So, I'm gonna dip the brush, the micro brush in the bonding. I'm gonna hand it to the dentist. He's gonna place it in. He's gonna dry that, and then we're gonna light cure bonding for 10 seconds. Or whatever the manufacturer's instructions is, but it's typically 10 seconds. So you light cure. So we need a curing light.